Hello and welcome to Health Digest, the program that brings to you news, analysis, and development on everything that concerns your well-being. Ogom is in the booth. Today on the program, we're diving into a complex and often misunderstood, will I say topic, will I say issue, will I say disorder, and it's called lupus. We're going to be looking at the causes, the treatment, and policies concerning lupus, and people who are actually we call them warriors, yes. And they're with me here in the studio. They'll be sharing their journeys, the ups and downs of diagnosis, their ups and downs in treatment, and how they've been able to navigate life with this condition. I have with me in the studio Dorcas Ade. She is an early years educator. Thank you so much for coming on the program. And I also have Noma Obed Okpoko. I got it very right? Good. Thank you so much for coming on the show. I think I will just quickly start with Dorcas. Yes. Can you start by telling us what lupus is about?
All right. So lupus is an autoimmune condition. And everyone in their body has a system, a defense system that helps you to fight diseases. So when you're ill, you have a cold or something, it fights it, and then when it's overpowered, then you break down and fall ill. So this our health defense system now is, will I say, confused or messed up. So what is in place to keep you from falling ill is there attacking you and making you fall ill. It attacks your healthy cells, something that was perfectly healthy, nothing is wrong with it, it's attacking it and making you ill. So that's what we call an autoimmune system. An autoimmune condition, yes. And lupus is one of many.
Oh, so there are so many autoimmune.
There are so many autoimmune conditions, but lupus is one, and there are different types. So the umbrella name is lupus, because, and then in lupus, the most common one is SLE. But going around saying systemic lupus erythematosus.
Please, don't go in there.
So we just say lupus. When we say lupus, lupus is lupus. So that is what it does.
For Norma, when actually did you get to find out that you had lupus? Did you actually started with some symptoms that were similar to malaria and all of that?
A lot of symptoms. You know, one thing with lupus, it doesn't come out with one direct symptoms. It gives you different. There are most of us that are warriors who've experienced being diagnosed with, giving wrong diagnosis. Yeah, it comes out with even symptoms that looks like cancer. It might even look like tuberculosis because you have constant cough and your body can actually fight a lot of things. I personally, I was diagnosed for HIV, for cancer, for tuberculosis of the bone marrow, it was as if I had Parkinson and many other things. Although my doctor said I had some kind of anemia, but then I wasn't getting fine till we had to do some diagnosis outside Nigeria, and that's how we found out that I had lupus.
So before you find out that you had lupus, you took all the malaria medications,
yes,
all the injections and all of that. So you were treating an unknown
illness.
But did you notice any kind of like skin issues or those?
Yes, I had skin ulcers.
Okay.
Yeah.
But even at that, they still didn't diagnose you had lupus.
First of all, the doctor said it's like it's an infection. I took antibiotics. I kept taking antibiotics. In fact, at a point, I told my mom, I said, I'm not taking this thing again because I was tired. It wasn't working. I was taking too many things. It wasn't working. And I was really anemic. Sometimes I'm rushed to the hospital with 13% blood level. My body is white and all, and they keep giving blood. But your body is not pumping blood. Instead, it might even be leaving your body. Because I know in August 2023, I saw my period for 2 weeks. I don't know if I'll call that a period. I was bleeding for 2 weeks. They were giving me blood and it was just going.
Wow. So all of this, until you were diagnosed of lupus, how long did it take?
It took months. It took almost a year. Because I started feeling sick from June 2022. In fact, it took a year because I was finally diagnosed in August 2023.
So what's it like living, with this condition?
Living with lupus. Is there a way that it's like? Because there are no words. There are no words. You can't describe it.
At all.
You can't explain it. But when someone is living with it, we just know. You just understand. Pain, discomfort, every it's your sanity. Your sanity. See, if you don't have any higher power that you believe in, if you don't believe in God, if you don't believe in something greater than you, even when you believe it, you can run mad because you don't understand what you're feeling. Lupus attacks anything. So we have the general symptoms, right? Joint pain, fatigue, stress, rashes, and all. But then this person, lupus, will decide, okay, let me destroy your heart. This one, let me scatter your kidney.
It goes to the organs as well?
Any single thing in your body can be destroyed by lupus. There's someone on our platform, her eyes, she's blind, she's so beautiful. Today is her birthday. We send voice messages. She can't see. I wear glasses. My sight is worse because of the medication. You wake up, like today you're happy-ish, okay? And then you move around. Then by evening, you can't walk.
Wow.
That's the funny
You
thing.
can't walk. Then tomorrow you can't do anything. Then the day after you're fine. Then the next thing you're in the hospital. Then you don't even understand. You can't even plan your life. I've paid for courses. I can't do it because I'm not even mentally okay. Then you have a family. You have children. You can't. It doesn't show. It doesn't show. And then living with lupus, people around, boy, you look fine. You don't look sick. You don't lupus pay, well, as long as you're not dying, bedridden, and misdiagnosed. Once you're diagnosed and you're on your medication, you look relatively okay.
Okay.
But the pain, there are no words.
Before the treatment starts, does it look like, how does it look like?
It looks like your village people are after you. It looks like
Spiritual
you
problem.
have somebody in the village, like, we Africans, because you have every ailment. I had arthritis, right? I had pain. It was confirmed arthritis pain. But then, how is my arthritis linked with my baldness, loss of hair? Then how is the loss of hair linked with my inability to talk? I had serious issues with my face. I could not eat, I could not talk. Then how is that linked to my skin turning black? Then how is that linked to, so it doesn't make any sense. And you see, so one person can have 5, 6 doctors, all of them independently treating something different. While it is lupus that is just having a field day, destroying everything it can in your system.
When I was sick, it was like a lot of people were far away. And the issue of it's a spiritual problem, it was making a lot of people just go far. But I just held on to my family because they were really strong for me. There were times that I couldn't do a lot of things, but just seeing them alone, my mom was, or even as low as my sister's children, Zara was too. She'll say, I want to help Auntie Norma go to the toilet because I couldn't walk. I couldn't do anything. So they assist me to the toilet. They were always there to do everything. So my family was, they were my great support. I also had support system outside the family, financially. They support, but my family, they were really there for me.
So managing this lupus, do you have to change your lifestyle? Do you have to change maybe your diet or something?
You change your entire life. It's changed. Your entire life is changed.
Sometimes when we talk about things like this, we'll laugh over them. You know?
When people say, oh, I'm lifestyle change, I want to cut my carbs,
You have not really seen lifestyle change till something happens.
You can't plan ahead. We're not even talking of thinking you will die. We're not even thinking of that. Will I be able to get up from the bed? You can't plan ahead. You just plan as each day comes. There are some things we need to stop eating. There's some sun. I don't go out anymore. There was a time, I have hats, big sun hats. The sun literally, not figuratively, literally burns my face. When I'm in the sun, it's like pouring scalding hot water on you, how you feel. So today, both of us are coming and say, thank God, no
There's
sun.
no sun.
We were
The
so
weather
happy.
was cool.
We have umbrellas, sunscreen. So this is major lifestyle change. You have to calculate. So if I want to go somewhere like now for this, I had a mental preparation. I didn't do anything. I had to not take some medication so that the side effects will not affect this interview and everything. So major lifestyle changes. You can't go out on a date with your husband, can't have family outing, take my children to the park, son. How?
You are afraid
Can I
of what
even
will
walk
happen.
round the park? So
This happens to you as well?
Yeah.
It happens.
I wasn't an introvert, but now I'm an introvert. I'm always inside the house. It must be very important before I leave the house.
Wow. So how do you handle flare-ups, fatigue, both physically and emotionally?
I just take my medications and sleep. If you are able to sleep, that's the only comfort you can. If you are able to sleep. Because the truth about lupus is, whether you take your medications or not, when a flare is going to come, it will come with its full chest.
I don't know if you've ever seen anyone with sickle cell crisis. Does it happen like that?
Yes, sorts of.
With pains,
Yes, I've been in a hospital with so much pain. Now, lupus flare, I can't do this. You can't raise your hands. You can't even eat. Your jaws are locked. You have sores all over your mouth, even inside your nose. How it came, I don't know. Just like that. Sometimes it wakes you up at 3 a.m. You just see that you are stiff. Your body is stiff. You can't move. Sometimes I could just lie down and I'm just crying because I'm in serious pain. I can't do anything.
Wow. So how do you face challenges when it comes to assessing care or getting medications? And how expensive are these medications, first of all?
The meds are super expensive. And okay, there's a drug. The major medication that we take is hydroxychloroquine.
Yeah.
And then depending on we have the general medications we take, then everybody has the one tailored to. So I have medication because the lupus damaged my facial nerves. So I have that nerve damage. I'm taking something for nerves. Then I had kidney issues, which I'm off. My kidneys are fine now. So you have that. So then when I started taking those kidney medications, the amounts, let me even go to the other one. There was a drug I was taking for the nerves. When I started, it was like 3,000 for a pack. As at 2 years ago, because I'm not on it now, the same pack, the same medication was 19,000. For that same pack that I started 3,000 the year before, and that's for 2 weeks.
Okay.
And that's one. There was time I was taking up to 22 tablets a day. And that's, so those with kidney, that kidney medication, so it depends on what is your issue, what is attacking. Besides the general one, you may not have numerous autoimmune conditions. You might have one, but different diseases. And then you just have the disease that it presents. So I have lupus, but I am going through exactly the same thing that someone with nerve damage is going through with lupus drama. Then somebody can have another thing and going through exactly the same drama that someone with that condition is having. So you have lupus and you're dealing with the damage that is causing. It actually damages it and you go through.
But these medications, are they actually accessible? Can you find them in the market?
Now, hydroxychloroquine has been scarce of late. You can get it according to our doctors, but it's going to be like double, triple the price.
And COVID did not help because everybody thought hydroxychloroquine is the cure to COVID, and then those that needed it. So some of the medications are accessible, even in the hospital. It's the minor ones, the over-the-counter on the board. There's some major things before you get it. Then when you get it, can you afford it? And this is something you have to take all the time. Skipping a dose, hopping and skipping won't help you. Even taking the full dose, you don't even feel relief.
Don't know when you have a flare. So imagine when you don't take the medications, how you would feel.
But care in the hospital, when you go to the clinic, seeing a doctor, being attended to by a nurse, how is it like?
The truth is, some nurses do not even know about this illness.
They are clueless.
There are some hospitals I have gone to and I'm like, I have lupus. And waiting be that. What is that? what's this? He say, yeah. I'm like, you're a nurse, so, and I'm the one explaining to you
What
my.
lupus is.
They do not understand. They do not know about the illness. When I was diagnosed, I was still at teaching hospital in Gogolada, University of Abuja teaching hospital. The nurses were confused. They were like, you are back again. You are back again. When they now finally diagnosed, they were like, what is that again? One say, nothing wey person no go here for this hospital. And I was like, me too, I don't know. It's the first time I'm seeing it. So it's only in hospitals, especially private hospitals, that are actually educated about this illness, that know what it's like. Yeah. When we had the Lupus Awareness Day, that was on the 4th of May, a nurse said in the hospital she works that she's the one educating other nurses that about lupus. They don't know what it is.
So what do you wish people to understand about lupus?
They should understand that not every disease shows on the face.
Yes.
It's not until my skin is peeling or my body is falling apart or I am bed. We have the days we're bedridden. But when I'm in bed, you're not seeing me. But the day I'm out, you won't know that 2 days ago I literally couldn't walk. People need to understand and stop saying, "But you don't look sick now." That's the most annoying statement for lupus warriors. As I'm sitting down here, I am in complete pain.
As you're fine like this.
Yes.
That's what they
Can you
say.
believe that every word that is coming out of my mouth, I'm speaking and I'm in pain? I walked here aching. We're in pain, but we did this because people need to know. I would rather have been on my bed. But people need to know. They don't understand. And they will just be, and we're very spiritual. Everything, God will do it. God will do it. I agree. I am a Christian. I believe in God. But understand with me, right now,
This is
I am
the
in
reality.
pain. Right now, this is the reality of what I'm going through. And then when you explain, oh, this thing has no cure. So imagine someone who was diagnosed at the age of 20, even at the age of 40, right? Taking medication forever. Expensive meds forever. Even if someone was giving me the meds, swallowing every day. People don't understand. Your friends will come, they get tired. You are still sick. Stand up now, let's go. And some people just wonder, are you making it up? And people just think you're lazy. You're lazy.
That word.
You're lazy. How can't you stand up? You were moving around yesterday, or I saw you. So they need to understand it doesn't show all the time. And we are not lazy. I don't like being out of a job because of lupus. I don't like sitting in my bed. I don't like not playing with my children. I don't like not hanging out with my husband and my friends. It's not fun. You can pretend for 1 day, 1 year, 2 years, 3 years, 4 years, 5 years. Seriously. So
I saw one of your warriors, and I saw some physical symptoms, injuries and all of that. So we have people who have those physical, then you have those who don't have. So when people like that have physical bruises and all of that, do they face stigma kind of?
I had terrible, very, very terrible. You see my face, you see my skin. Someone is telling me, why are you so black now? I'm dark complexion, but I was black, like suits, black. And you'll see me, I'm already self-conscious, and then it's in patches. So there are different types of lupus. So there are some that actually affects the skin, damages it, and then leaves visible scars. And some of these patches are white. And then, so just imagine having discoloration on your face. And you know, people will be staring or be looking or be wondering, how much makeup do you want to cover? You just want to live your life and be yourself. There's a lot of stigma, and many people think it's spiritual. Who did you offend? Someone was asking me, do your in-laws like you? I said, my in-laws love me. Thank God my parents are not like that, because we would have quarreled. Oh, drink this or something, you need to pray. I know one man of God. So those are the myths. Nobody can believe that you're up today. You know, it's like Ogbanje. Today you're sane. tomorrow
you are insane.
you are insane.
My mom even had to encourage me to cut off from those people that were saying it's a spiritual problem, because my parents are not the kind of person that they say, go to this church, go to there. We believe in my family that we can pray out our own miracles, and that's how we handle everything. I cut a lot of people out because when I had the skin ulcers, you see the black spots that the ulcers left. I couldn't wear anything that would really expose. I couldn't come out. But the day I wore one skirt, like it was on my knee, if you see my whole leg, immediately someone that had not spoken, what happened? What's this on your leg? You say, are you sure this is ordinary? That's why I blocked her. There and then, because I'm already going through a lot.
You don't need that.
Don't come and add to my, because I don't really know what's wrong with me.
How can society, when someone is going through some issues and yes, someone tells you, oh, don't worry, you'll be fine. How can society better support people living with lupus?
First of all, stop being too spiritual.
Yeah.
Because every religion, Nigerians were religious. So you see me, you see my condition. I'm trying to enlighten you. I'm trying to explain. No, it's not your portion. Hey, don't say it.
Don't say it.
Don't say it. So if I don't say it, now as I'm saying this, some people are saying that my faith, I don't have.
You're not
I don't
strong
believe in
enough.
God because I'm saying it. If I don't say it, how will you understand? Yes, God will, but this is what I'm going through. And even if, yes, I'm miraculously healed, what of the next person that doesn't have that faith and is in pain? People should calm down. They should calm down and listen. They are so quick to jump into solutions. Everybody has a solution to give you. You're not in it. You're not facing. If you know you need to. I don't need to. Just keep quiet. I'm in pain. Sorry. One day I say I'm tired. Hey, don't say, but I am tired. I'm in pain.
Actually.
I said, please, I didn't say I'm suicidal. I didn't say I want to end my life. I'm tired of being in pain. Come on, for years.
Being expressive.
I can't even express how I feel without being shut down. People should just calm down. What you don't understand, listen. If you don't have any nice thing to say, just say sorry.
So exactly.
And keep quiet.
That sorry is enough.
Now, we talked about treatment earlier, and I will go back to treatment because you made a point where you said even when you were diagnosed, some nurses around did not even understand what you were going through at that time. Should you think we should have more like a hospital designated for cases like this?
Yes, please. We really need it because even the specialists are hard to come by here in Nigeria. In more than 4 hospitals, it's
Is it 4, 5?
one
Abuja.
same rheumatologist that sees all of us. It was
In
on that
Abuja?
Yes,
Abuja.
on that 4th May that I found out that it was Dr. Pham
That was
seeing
everybody's
all of
doctor.
us in different hospitals. Private,
general,
government, and
everything.
so please, yes, it would be good if we have.
I don't want to ask what the number is in Nigeria, but from your support group, how many do you think you are?
I know I met
She
more
joined
than
us recently.
Yes,
Okay,
and,
okay.
we're over 100, we're over up to
Yes.
200.
And
over
you have
100.
one doctor seeing.
All of us is our doctor.
we are all
That's
in
all of us
love.
in Abuja.
Okay,
And you
yes.
know the funny twist to this? He doesn't live in Abuja.
Wow.
He comes from Jos. He visits all the hospitals, goes home to his family over the weekend, and then comes back. And this is Abuja. So what of those who are living in other places? All are rheumatologists. There were not that many before. They've left the country. And then imagine someone with lupus in pain. You go to the hospital, and then you have to wait 4 or 5 hours.
And then even talking about ours, if you like the hospital I use,
You can't
he only
even
comes
go.
on Friday. So if you have a flare on Monday, on
You have to wait. He comes
Friday.
once a week in all the hospitals. He consults once a week, so there's no emergency. And when you go to see any other doctor,
You just take
It'd
you.
be like, we'll just wait for your
they'll
doctor.
just manage you at that
Yes.
point. So at this point, what message do you have for our policymakers regarding issues like this? I think I'll start with you.
We need support
What kind of support do you need?
financially, especially if they can subsidize the prices for the medication. It will really be helpful because most of us are being assisted. We do not have, we can't cover the expenses. Sometimes Another thing bringing headaches to many of us is when your medications are almost out.
You start panicking.
You start panicking because you don't know how to start getting it. We need to. They need to help us create more awareness. We need help. Help in capital letter.
Bold.
Yes.
What's the same thing? Awareness. Everywhere you go, there's no one that doesn't know what cancer is.
Yeah.
I'm not watering down cancer. I'm not saying it's not. Cancer is terrible, right? But there is help. Anybody who is diagnosed early with cancer has hope of treatment. With your, well, lupus, even with your money, there's no hope. There's no lupus center. Even, we're talking of nurses. What of doctors? They hardly know what, they know about lupus, but they don't really know lupus. You understand? Because if they knew, I won't have to see 10 doctors. None of them could pinpoint that it was that. I won't have to see 10 doctors before I was diagnosed. I won't have to see all those doctors before getting the test. Let's have lupus centers. Let's have a place where we can be on admission and the right medication is given. Let's have somewhere where you go and then the meds are there. Let's even forget the expenses.
Yeah.
Let's even see the medicine.
Let
it even be available. We'll hustle money. Chemo is expensive, but it's available. People do GoFundMe, get things, family, friends, whatever. Okay, see me, see my money. Where's the doctor?
And sometimes
He's
when
not
you want
there.
to buy these medications abroad, it's not like Nigeria.
It's not
you
over the
must
counter.
come with a doctor's
Prescription.
before they're able to sell it to you.
So before I let the two of you go, my warriors for today, before I let the two of you go, how do you go through life generally? Like, because lupus is something you have to manage for the rest of your life. So how do you just scale through? You wake up in the morning, how do you just live life? Because I remember when we were discussing, it says something about sadness, that you can never be sad in this life.
We are sad, but when you're sad, you face the
you
consequences
cause more
of
problem
the sad.
for yourself,
Because
so you just have to stay happy.
a major trigger besides sun is stress and your emotions.
Yeah.
If your emotions weigh you down, your lupus will hit you hard. If you're stressed, so now you have drugs you can't afford and you cannot do anything stressful. You can't even hustle to get the money to do it. Are you going to sit down and be dependent on someone for the rest of your life? So how we go through life each day, you wake up, you have to have a purpose for living. If you don't have a purpose, you will not survive. If I did not have a supportive husband, if I didn't have a loving husband, if I didn't have a loving family, if I didn't love my children, right, and I'm looking, will I leave these children? So I have a purpose when my children come, and we're a very close-knit family, and even my siblings, we're close. When I think of how they love me, when I wake up each day, I'm in pain, I tell myself, it's not all about me. So,
having a support system is all you need. Like when my mom comes to wake me every morning, and the first question she says, Norma, how are you? How are you feeling? So that alone gives me hope that
Another day has come. So
yes,
how to live
and when I say good morning, ma, she said, okay, when I come out for devotion, I just stand up on my bed and I say, thank you, Jesus, for another day, and I go out. Just stay positive. Because the more you keep thinking, I have lupus, I don't know, you will not die, but you will keep suffering. Because you continue taking your meds. It will get worse. So just stay positive.
So for those who have been recently diagnosed of lupus, your message for them today is to live life one day as it comes.
yes, find a support group.
Find a support group. Okay. So if you need them as support system, you can always reach out. You can always reach out to me, and I'll be there to link you up to them, so you can actually get support. Because from what they have said, not just about lupus, anyone who is having to go through one illness or the other, the only way to scale through it is to be happy. Because once you know that you have this condition and it's something you have to manage for life, you have no choice than to be happy. Because the moment you tell yourself, not be me, it's not my portion, it's already your portion.
You reject it. Whose portion is it?
Because it's already there. It's already, yes, we all believe in God. But when something like this happens, you have to know that the more you put in efforts, God will also help you to scale through. And so if you're just recently diagnosed with lupus, or you're one of the lupus warriors, or you're going through suffering any kinds of illness or ailments, all I want to tell you today on the program is stay positive. My name is Ogom Ezidimbo, and that's our package for today. Thank you so much for being a part.